some of you have been cannulated before, or you have seen someone moving with a cannula, isn't it?
Yes.
The cannula, it looks like this. This is the cannula, though it has sizes, okay? When you open this cannula, it has sizes. So the bigger the number, the smaller the cannula. Are we together? Then you are going to find that when you are cannulating this one, you need to assess the type of the patient you are cannulating. So in most cases, for example, some of us here, you are shooting. You said it.
No.
Oh, so some of you here, especially most of you, the cannula, the best cannula they can use on you is the blue one. The one instead of having green, but a blue one. Then the yellow or pink, we use it in neonates or pediatrics. Because we are going to find that, for example, when you open this cannula, right? You open this cannula. When you look at the needle, this one, it's very small. So now, even in the fluoride, it changes, isn't it? If you have a cannula like this one, then we cannulate you. The way the fluids will be going into your veins, it will not be the same way the fluids, or the same rate at which the fluids can flow into your veins when you use this one. So this one is bigger than. So for those who have bigger veins, right? For those who have bigger veins, we use the green one, which is big. Some they can even use the gray one because they are very big. Are we together? So it depends when you're assessing the patient. It also depends with how big the cannula, the blood vessels are. Are we together? So when you see that the blood vessels are very small, or they are not big enough for you to insert the cannula, then you need to do what? To change the cannula. So they go with what? The sizes. Are we together? So the size, when you are looking at the cannula, it goes with the size of the blood vessels. For me, the blood vessels, I think they are very small. So if you cannulate this, you put this one, it will be very big and it will be painful for the patient. Are we together? So the other thing that we need to understand about this is that we only cannulate the vein. Hello, am I talking to someone? We only cannulate the vein. We cannot cannulate the artery. So these blood vessels that you are seeing that are prominent to the skin or to the superficie of the skin, these are the veins. And that one, that's where you're going to find the what? The arteries. The reason why we cannulate the veins, whatever you are putting in the body, it has to go first to the heart. Are we together? So that it can now filtered, everything is removed, then that's when now it can now be pumped now to go to the tissues. If you cannulate direct into the artery, what will happen is, when you cannulate direct into the artery, the tissues will receive that medication. Are we together? Everything. So you'll find that if the medication is, the toxicity of the medication is high, you're going to find that you can even lead the patient now to death. So we use the what? The veins. Good morning, madam. I'm student Mwenya from Rusang University, and I've been assigned to cannulate the patient on patient number 5. And the name of the patient is Mr. James. He's due for intravenous infusion. He's receiving ringer's lactate. But before we do that, we need to cannulate the patient. Is it okay? I can go ahead. Okay, thank you so much. So the next thing, I need to go to the patient, isn't it? Okay. Who is going to be the patient? Mr. James. Do we have Mr. James here? Can it be Mr. James, right? Yes. So this is the patient we have. Okay. So when I'm going to the patient, we are going to do it in such a way that we follow all the steps, isn't it? I just have to wash my hands and go to the what? To the patient. Okay. Good morning, sir. So I'm student Mwenya from Rusang University, and I've been assigned to do a certain procedure. What is your name?
Mr. James.
Okay, so Mr. James, you are scheduled to receive ringer's lactate, 500 mils at 12 hours. But before we do that, we need to cannulate you. Now the main essence of cannulating is that we want to infuse the fluids so that as you are receiving the treatment, you can also receive the fluids. Is it okay that I can go ahead with the procedure?
Sure, go ahead.
Okay, so let me just go back so that I can come and assess you. So I'll put the drug chart. If there is the file, I'll put the file. I do the hand washing. I need to go with what? The pair of gloves, isn't it? Hello? I need to go with a pair of gloves because I need to do what? To assess the patient. Are we together? Now, as I am assessing the patient, I also need to put in advance the draw sheet and everything. Are we together? Okay, so now what we are going to do is the assistant can just put the trolley nearer to the patient. You can just put the trolley. You can put it from there. You can put it from there. Yes, nearer to the patient. All right, thank you. Good morning, Mr. James, once more. I am back for the inspection. So I need to inspect to see where you are sleeping. So I'll just expose you a little bit. I need to prepare you. So at this point, I'm not only inspecting the patient, but I'm also doing what? Preparing the patient for what? For cannulation. Okay, so I have to don in gloves. These are cleaning gloves. Okay, I have to don in gloves. Then the first thing that I'm going to do to this particular patient is that I need to assess the general condition of the patient. Are we together? If the patient is responsible, the patient can respond, or the patient is not responding. The next thing that I need to do, we remember when we are doing the health assessment. So the kind of health assessment you are going to do is now system by system, but in a very quick way. Okay, if the patient is responding, you are going to say the patient is in good state, isn't it? Then the other thing that I need to inspect on the patient is now the general condition of the what? The skin, so that I can know which part am I supposed to use for me to do what? To cannulate. Are we together? So that one now is the assessment of the what? The skin integrity. If the patient has a lot of veins, then I need to change the position I'm going to cannulate. Now, looking at the assessment, I see the patient, so I need to cover. If the patient is covered, I need to uncover the patient so that I can see where the patient is what? Sleeping. Now, during health assessment, we also need to understand that as we are assessing the patient, if you find that the patient has passed stool or the linen are soiled, you immediately change the procedure. You cannot cannulate the patient when the patient is sleeping on the soiled linen. Are we together?
Yes.
Yes, so to promote the hygiene, the good hygiene, to promote the healing, we need to make sure that the patient is in good condition or good state. Okay? So the next thing after assessing, I need to get now the what? So now, this one we are saying this is the what? The tourniquet, isn't it? But there is that tourniquet, the medical one. Okay? So I am saying I'm going to cannulate, for example. Before I tell the patient that I'm going to cannulate, I need to tell the patient to make a fist, okay? So when the patient make a fist like that, I need to tap, like to percuss. Remember percussion? I need to percuss. Now, if I see that the veins here, they are big, okay? They are large enough. And I'm seeing a lot of branched ones. What do? I percuss from the other aspect, isn't it? I percuss from here. Then what I'm going to do is I am going to tie from here. We are assuming this is the tourniquet. I tell the patient to make a fist. Then I see that this is the one I'm going to do what? To cannulate in. Isn't it? This is the vein I'm going to cannulate. So what I do, the next thing is to what? To loosen this tourniquet. I loosen the tourniquet. I'm not supposed to leave the patient with the tourniquet which is so tight. Okay? Then the next thing that I'm going to do is patient preparation. We are in second stage. Are we together? Patient preparation. What do I get? I get the what? The Macintosh, isn't it? Okay, the Macintosh. Okay, so now I need to call the assistant. Hello, I need to call the assistant. The assistant is supposed to be gloved. So the assistant can get the gloves from there so that you can be gloved. I need to put the Macintosh, and I have to make sure that the whole part which is supposed to be cannulated is also lying on the what? On the Macintosh. The next thing I do is to get the what? The draw sheet, isn't it? I get the draw sheet like that. Assistant, you can help me by lifting the hand. Okay, I put the draw sheet. Okay, straighten it. We have prepared the patient. Are we together? I tell the patient I will screen for privacy. we have prepared the patient. Okay? So now, after preparing the patient, I need to tell the patient that now we are going to now to the third stage where we need to prepare the what? The trolley. So I need to tell the patient that I'll be back and I'll be back to do what? To cannulate. Are we together? Okay. So now, since we have prepared the tourniquet we have, okay, but it has to be loose, okay? We cover the patient. By the way, we need to cover the patient so that the patient is comfortable. We don't have to expose the patient to hypothermia, okay? The next thing is to remove the gloves. Then I wash my hands. Remember, we are preparing the trolley from the treatment room. Are we together? Sometimes the patient can just come maybe through the OPD and you have to cannulate the patient, and the patient will be in the treatment room. You can prepare from there. Are we together? So the next thing that we are going to do is now to remove that, isn't it? Because we need to prepare now the what? The trolley now. The bottom is okay. What we need to prepare is the top, isn't it? So the assistant can just come and remove the drape. Though you are not supposed to remove the gloves, but you're donning the gloves. So you can hold from here so that you can receive it, okay? Alright. So the next thing that I'm supposed to do is now to start preparing. Are we together? So how do we start preparing? The assistant knows how to use the what? The cheeto forceps, isn't it?
Yes.
Hello? The assistant knows how to use the what? The cheeto forceps. I have washed my hands, and she has also what? Washed my hand. She has washed her hands. So now, what we are going to do here is that we need to prepare, isn't it? So the first thing that we are going to do is now, I can tell the assistant to be getting things from there, then I use the forceps. Are we together?
Yes.
I will use the forceps, then I do what? I prepare now. For the sake of practice, we can get the cheeto forceps down here. You can just put it here for the sake of learning, okay? So now I need to instruct the assistant what to do. So the assistant can get, you can get the gloves for me, the sterile gloves. So away from the sterile field, the assistant is supposed to read what is there, okay? So you read the expiring date and how you are supposed to tear it. The expiring date is what? Down there you'll find the expiring date. Can you show me? Just show me. Okay, so the expiring date. So the expiring date is 2025. It expired in 2025, the 5th month. But it is potent for use. We'll use it. Okay? We'll use it. So you can tear it down. Okay? So you can either read for yourself, isn't it? So now, like that. This is the, then we do like that. This one, okay. So I need to get the glove like that. Then I drop it there, okay. This is sterile, right? So we can do that way. Can I use the other one? Because this one, now the position, okay, so that we can get this one. You put it on top like that, and the left one like that, okay. I go in like that, okay. The assistant, you can get now the syringe, 2 syringes, you open them. You go down, then you get the syringes for me. You are supposed to read also the expiring date, okay? Because these are they are sterile.
Expiring February 2028.
2028. So it is potent for what? For you. So you tear from there, okay? Just expose. No. Wait. You expose it again, okay? So I need to get the cheeto forceps like that. Then I get this one. I put it in that receiver. You can do the other one. Okay. We're supposed to open it from the other side. Okay. So the next thing, because we need the needle so that we can get the fluid from there. Are we together? So we can use the same needles. You can open the needles for me, 2 of them. You read whatever is there.
Expiry date December 2027.
So it is potent for use, right? You open from the cup there. Just on top, you're going to find something. Okay, she has managed to open. So I'll grab this one. I put it there. You're not supposed to get tired of this, of getting the cheater for safe. She has to open the second one. Okay, the other one goes back. Okay. Okay. The next thing that we need, okay, at this point, we cannot now use the cheater forceps, isn't it? So it can even go back or it can stay wherever it is, isn't it? The next thing, because the solution that we are supposed to use is spirit, isn't it? So we can get the spirit, okay? We can get the spirit. So I'll go around and get methylated spirit. So this is methylated spirit. It is expiring on 20th December 2026. It is potent for use. I will pour away from the label. Okay? Is it the label or the label? Okay. The next thing that we need to get is the cannula, isn't it? The cannula is supposed to be picked by the assistant, isn't it? Or you can pick it. Are we together? You can still pick it and it just read whatever is there. So you can pick the cannula. You read what is there.
Expiring 2026.
2026, which month?
July.
July. So it is potent for use, right? Okay, so now it cannot be used, right? Can we get another one? You can get from there. No, not from there. Yes, just open there. You'll find some cannulas in the box. That other box. Yeah. Yes. Please, when you're preparing, you put even 3 of them. So in case of an accident, you can just replace it. So the cannula is supposed to be on its own, okay? The next thing that we need to prepare is strapping. We need to do what? To strap, isn't it? Okay, so I'll get this one. Then I'll get the scissors. So now the strapping, if you have the one which is supposed to be for the cannula, so this strapping, you're supposed to separate it like that. Then the other one, like that, okay? The next thing that we need to prepare in advance, the next thing that we need to prepare in advance is the fluid. Are we together? So how do we prepare the fluids? So if you have water for injection, right? If you have water for injection, what do? you get it and clean it the way you clean what? The medicine, or when you're giving an injection, right? So that you can put on top. Are we together? Now, since we don't have that, because this one, it was just for learning purposes, okay? This one is just for what? For learning purposes when we are supposed. So, if they have told you to say, after cannulation, you are supposed to use this so that you can infuse. What are you going to do? You use the same fluid. You can use the same fluid, which is there, so that you can what? You can infuse when you are done with the cannulation. Or you can use the normal saline, or you can use what? D5. Are we together? So can I have the normal saline bottle from there so that we can pour from there? Okay, so now you can pour for me in the other galley pot. You read what is there, then you can pour away from the label.
This is normal saline content for use.
Okay.
Pouring away from the left.
Enough of them, yes. All right. Okay, now we are done with the preparation. We are done with the preparation. The last stage is now to do what? To cannulate, isn't it? Okay. So we can put this one there. The last stage is now to cannulate. So how do we cannulate now? This is why I want you to pay much attention, because these preliminaries, you know them. So I need now to do what? To scrub. Hello? I need to scrub, isn't it? Okay. So I'm done with the preparation. I need to scrub. Remember, the scrubbing is supposed to take how many minutes? 5 minutes, isn't it? So you need to scrub. 5 minutes, you're just washing your what? Your hands. Are we together? So we are going to do it now, because this is the procedure. We need to scrub so that for those who still misses some steps, you can still remember. Yes. So, no, soap is there. Maybe you can just get the brush from there. Anyone who is told to get the brush? The brush? Okay. So now we need to scrub. No, this is not the brush. There is a black one from there. Okay. Okay. So you stand like this, isn't it? You open your legs like this. You stand like this. Then you open. Okay. You can give him the bus up from there. Can you give him the bus up from there? It's not there? If it's not there, it's okay. So leave the one which is there. The brush. Okay, now, so the first thing, I need to rinse. So I need to rinse up to the elbow. I also get this one up to the what? The elbow. The next thing I do is to get now soap. I get some soap from there. Enough of the soap, right? I got the soap like this. Then I start washing, okay? Up to where? The elbow, right? This hand, it goes like that. Then I transfer the soap. I start with this one. I go like that, okay? This hand is clean, then I need to clean the other hand. Up to the elbow. The hand which is cleaning, it goes like that. I transfer the soap, then I go like that, okay? Where should we go now? Okay. Halfway, like that. The hand goes like that. I get this soap. Okay. The other hand which is not clean. The hand which is cleaning goes like that. You transfer the soap. It goes like that. Okay. The next thing is to get what? Soap. Okay. I put it there. Then I get now what? The brush. I rinse it. Then I start now scrubbing like that. Each finger, just like that. I make sure that I The first thing is the brush. Okay? You rinse the brush. The part which was got in the brush, go up to the elbow. You get this hand, you go up to the elbow. Okay? You get again soap. Okay? Okay, this hand, I get this the brush, I rinse it. The scrub. You rinse this one. The one which is cleaning. Then this one. Then I get now the soap for the last time. You do now the hand washing, right? Okay. So you do like that. The dorsal part. The other dorsal part. Each finger. Start with this one. Nail bit. Then the wrist. I go like that. I go like that. I am done with scrubbing. Where do I go? Is it the whole place?
Yes.
So I need to walk very majestically. Even when you don't know, you just have to walk like that. Okay. So this is the first part we are going to use. Okay. This hand is supposed to be hanging like that, but it shouldn't be in contact with your head because you are going to contaminate something there. So we get this hand. First part. We go now. Up to the elbow there. You get the other part. You part dry. You hold it. You go to the back. Make sure that in between the fingers. Okay. Where are you going to put it? You can throw it down there, right? Now you can even wait a little bit, maybe 30 seconds, so that your hands are dry completely. Are we together? Okay. That's when now you're back to the patient, isn't it? Okay, you're back. If you're preparing the treatment room, you come like that to the patient, so that the assistant is the one to move the trolley. Now, we are back to the patient. So what we can do is, okay, maybe the assistant, for the sake of time, you can just, the hand can be taken that side, including the draw sheet and everything. Okay, so the first thing that I need to do is, I need to do what? To gloving, right? So I get this glove, I go in. Which type of gloving is this? The what? It's the open. Don't worry, even if they fight for one finger, it's okay. This is the open, isn't it?
Yes.
Okay, so at this point I can now touch like that. We are going to fight with this glove because the hands are still wet. Let's hope we are following. These are the consequences of not wetting the hands to be dry. But if you are doing that, please, you make sure that they are dry, so that you don't have any. When you do like this, okay? The next thing that I need to do now is to prepare now the trolley. So now, how many swabs am I going to use from there? Then we start now preparing. Probably you can just use, depending So now we are going to use the what? The spirit, isn't it? Okay, depending. You are not supposed to talk, please. You are not supposed to talk from this field. Are we together?
Yes.
But allow me to talk because I'm teaching. So we prepare. You can put them there. Okay. If you need enough of these, you can still prepare. The next thing that you need to prepare is what? The what? But if you had maybe where you're getting it from, you can tap it, then you tell the assistant to do what? To get from that bottle. Are we together? But now, we are just getting the normal saline from here, isn't it? So, you do like that, and you make sure that you don't touch this part. Okay, so even when you are withdrawing or you are getting, you are holding this, then the index finger is the one now which will be putting it back. Okay, so depending, if you want, you can just prepare maybe for 5 meals, it's enough, because you just want to make sure that it is in the appropriate tissues. Okay, the next thing, I'm going to the patient. I need to drape the patient, right? So this is the end, and this is the other end, like that. How am I going to drape it now? Which one is supposed to go to the patient? The one which is facing me or the other one? So where you have put the tourniquet, okay? Now that tourniquet is supposed to be covered by what? By the drape. You have already made this part to be what? Sterile. Are we together? Okay, now the next thing that you are going to do is you are going to get now. So the tourniquet, you're not supposed to hold it, the tourniquet, without gloves. This is just clean, but this is sterile. So you tighten it so that you are able to see what? The vein you want to cannulate. Okay. Then at this point, because I am just touching this, so I haven't contaminated anything. Okay. So I'll get this swab, the first swab. This is the part which we are cannulating. Okay. It goes like that. So just once, okay, just once like that. You throw it in that receiver which is receiving the dead swabs. You get another one. You clean like that. Okay. Then the next thing that you are going to get is what? The cannula. Are we together? So you get, if you want, you can transfer this to where? Because this is what? Clean. Are we together? So that you avoid unnecessary movements of going back to the sterile field. But if you are conversant enough, you can still work from there. But how do we get it? So you are going to get it like that, okay? Then you remove this one, isn't it? You remove the cap, you drop it there, then you come with it, because this is sterile, okay? You will come with it this side, isn't it? So you give it to this hand. Are we together? So now at this point, you just have to do what? These flaps, okay? You just straighten them like that. Then you get now the cannula, isn't it? So where you are holding, okay? Where you are holding it, isn't it? Where you are holding it, you know that I'm supposed to do what? To cannulate from this part. So you go in a little bit just on the tip. When you see that blood is coming in, when you are able to see that the blood is coming in, what do? You withdraw the what? The needle like that, so that as you withdraw the needle, this one will go in. What else you are withdrawing the what? The needle, and this one will go in. You will still see blood coming out. So now, before you remove the needle, the whole needle, because you're not supposed to remove the whole needle. Before you remove the whole needle, you get this cap, okay? You get this cap. The moment you remove the needle, this needle is supposed to go into the what? The sharp box. But now, as you are removing the needle, what do? At this point, you can straighten this one and just place it there, so that as you are waiting for the assistant to bring the sharp box, you can throw it there, okay? But since we are done with the sterility there, you can even throw it there. Are we together? Then what do? You close this part, okay? First you close the part. When you are done with the closing of the part, then you get what? Strapping. Are we together? Now before you get strapping, this one is still what? Sterile. What do? You get first the required what? Fluid. So that when you open this, okay, you're going to do like this. You open this. Even if you put this one on top, this is sterile. Then you're going to push in the what? The 5 mils. But now, when you're pushing in the 5 mils, you make sure that there are no bubbles inside, because that is going to create an emboli. And you know, if air emboli goes to the lungs, what will happen there? There will be now pulmonary what? Embolism. When the patient, you find the patient now has stopped breathing, isn't it? So what do you do when you push in the fluids there? You push in. If you see that it is resisting or the fluid cannot go in, then it is not in the blood vessel. Are we together? It is not in the blood vessel. But if you see that the whole fluid can go in, there is no edema on the peripheral aspect, then it is what? It is in situ, right? You close. You close like that. After closing, expose it. You get now strapping. The one you separated, okay? The one you separated is the one which is going to be like this. So where you're going to find these, the flabbies there, the wings in short, these wings, you cover them like that, okay? You cover them like that. Then you get the other one. You get the other one. Then you cover like that. The post-examination or the post-procedure thing is that this one you already loosened it. And what do you do? The next thing is to do what? To remove the drape, the fenestrated drape. You thank the patient for cooperation, and you do what? You give IEC. What kind of IEC are we going to give to this particular patient? Number one, they shouldn't touch. Are we together? Again, what they are supposed to do is that they shouldn't use the same hand for what? For eating, isn't it? That's why we go to the hand which is not working, okay? So the other thing is that they are not supposed to pull it back. In case they feel pain, they should call the nurse so that we can change. Are we together? Yes. So that is how we can do the cannulation. So the next thing, after removing this thing, you need to dismantle the trolley. After dismantling the trolley, you go to the what? To the ward in charge with the file, documented that you have done what? You have cannulated. Are we together? So before you even went to the in charge, you have already removed all these things.